Welcome everyone to our first webinar with Indian Menopause Society. And here I welcome our moderator for today's afternoon, that is Dr. Anita Shah. She is MD DGO CIMP and she is practicing gynecology since 1988. She has been the president of Surat Obstetrics and Gynecology Society in 2001 and 2001 and organizing chairperson of World Conference on Population Stabilization, February 2003, organizing secretary of National Conference of Indian Menopause Society, and president of Ulna Medical Association, organizing secretary of State Conference of Gujarat since 1998 till 2016, founder chapter secretary Indian Menopause Society, Surat chapter and national chapter, national chairperson for 35 clubs and committees of IMS, ex-secretary of the Surat Medical Consultants Association, currently Secretary General of Indian Menopause Society, participated as a faculty in many states, national and international conferences. Over to you, Dr. Anita.
Yeah. Very good afternoon, friends. Very good afternoon, friends. Hope I may not have stolen your afternoon nap, but please have a good cup of tea or coffee. By the way, thanks a lot, Sana, for your kind words. Friends, in this corona pandemic, digitalization of IMS academics, I got the opportunity to moderate and participate in many webinars. But today I am very happy, and as I am going to moderate the webinar in which all my IMS family members are waiting to see and get blessings from Dr. Rama Vaidya, who is the founder, president of Indian Menopause Society. Rather, IMS was the brainchild of Madam Dr. Rama Vaidya. The detailed introduction of the Rama Madam will be given by Dr. Rashmi Sa afterwards. I am also lucky that to have Dr. Rashmi Sa as my co-moderator, who is also the founder member of Indian Menopause Society. She is a consultant gynecologist, ex-senior deputy director of ICMR. She has undertaken numerous studies in the area of menopause and osteoporosis. She was awarded INSA fellowship, during which visited menopause clinics in UK too. She initiated and conducted various contraceptive clinical trials, OC pills and IUCDs, etc., and medical abortion trials also by WHO. She had conducted numerous symposia, workshop, training courses in research area mentioned above, several publications in national and international journals also, an executive committee member of Indian Menopause Society, IMS. She is patron of Indian Menopause Society Mumbai chapter. She was ex-treasurer and joint secretary of Indian Menopause Society main body also. She is the founder, coach, chief editor, Journal of Midlife Health of Indian Menopause Society, and she is associate editor also of the Journal of Obesity and Metabolic Research. Dr. Rashmi Ben, in short, I would like to say that she is a very smiling lady, always full of discipline, hard work, honest, and outspoken lady. She is fond of traveling. You can see that Dr. Rashmi Ben is always fit, and the raz of her fitness is the regular exercise, including swimming. She remains fit, and she always make us also to remain fit. Friends, as you all know, you all are aware about that the Indian Menopause Society is a multidisciplinary system whose main motto is to provide a healthy, happy, good quality of life to a midlife woman in her menopausal and postmenopausal period of life, with the slogan that fit at 40, strong at 60, and independent at 80. This is only possible if her all issues of menopause are solved properly. Up till now, We have discussed menopausal hormone therapy very deeply by various webinars. We all know many a times patients are not willing to take menopausal hormone therapy. They rather are not convinced. And sometimes we also have some contraindications in which patients we couldn't use them also. So today we are just planning to discuss regarding the alternative therapies for treatment of menopause. Before I introduce Dr. Vaze Madam, who is going to talk in this, let me introduce our dear President, Dr. Jignesh Shah. Dr. Jignesh Shah, before he gives a few words regarding welcome, I will say a few words about Dr. Jignesh Shah. You all know about Dr. Jignesh Shah everything, because nowadays he is seen on the screen day in and day out. I can say that all the webinars running all over India, and Jignesh Bhai's photo is there. His as a panelist, as a moderator, as a chief guest, everywhere, each and every corner, Jignesh Bhai is seen. You all know about Dr. Jignesh Shah, that he was president of Indian Menopause Society of this year. This is the silver jubilee year of Indian Menopause Society, and he was organizing secretary of West Zone Yuva Foxy Ahmedabad in 2020, vice president of Indian Menopause Society 2017-18, past honorary convener of state organization of obstetric gynec societies of Gujarat, that is SOGOG, for 2011, 12 and 13. She was past president of Ahmedabad OBGY Society 2006 and 7. She organized a number of state and national level conferences and workshops as organizing secretary, organizing chairpersons, like that. So nothing new to be added regarding Dr. Jignesh Shah. Jignesh Bhai, I would like to invite you for a few welcome words for today's webinar. Not audible. Please unmute.
Now?
Yes, now you are audible.
Thank you, Dr. Anita, very close friend and very sincere, efficient, and as she used to say, obedient secretary of Indian Menopause Society. Right, Anita?
Yes.
So thank you very much for everything, and thanks to Bharat Serum and Science Integra for supporting today's webinar. On behalf of Indian Menopause Society, it is my pleasant privilege to welcome all the viewers across the country to today's webinar. Friends, today we are very fortunate to have two founder members as faculty. First is founder president Dr. Rama Vaidya, the guiding force and most respected person in IMS, along with founder member Dr. Rashmi Shah. Let me take this opportunity to say a few words about Indian Menopause Society in front of them. Indian Menopause Society is a multidisciplinary society which was established in 1995, and this year 2020 we are celebrating Silver Jubilee year. Madam, your small thoughtful seed with a very big vision today become a Vatvrix with 4,000 members and 45 branches across the country, and it has really proved a boon to menopausal patients. Thank you, madam, for everything. Please give her a big hand. No one can see, but at your place, you can give a clap. Thank you.
Yes.
Thank you all. Friends, Dr. Rama Vaidya has started the organization, and after her, all our past presidents had worked very hard for spreading awareness about menopausal problems amongst gynecologists, amongst paramedical persons, as well as to the public. And friends, so far we are successful in creating awareness. But I'm sorry to say the same thing is not observed in clinical practice. On one side, patients are aware about the problems, but they don't know to whom to contact. Gynecologists are aware about everything, but not applying their clinical knowledge in management of menopause. So as it is said, many people know what to do, but only few do it. But friends, we have to remember that now average lifespan of Indian women has increased to more than 70 years. And woman is spending more than one third of her life in menopausal stage. And at present, more than 20 crores of Indian women are living in 40 plus age group, and many of them are having distressing menopausal symptoms which may need immediate attention. So it is very important to keep ourselves updated regarding management of menopausal age group health problems to provide quality of life to our Indian women. Friend, our Silver Jubilee year theme is Flying High with the Wings of Menopause, and motto of the year is Preventing the Preventable. As it is a Silver Jubilee year, we had planned many activities, academic as well as public awareness activities, but because of this lockdown, our activities are at hold. But as it is said, a challenge only becomes an obstacle if you go to it. We have accepted a challenge and decided to go ahead with webinars and quiz activities which are appreciated by our members as well as FOXY members. Also, all our chapters and societies are there doing their individual webinars and individual innovative activities. Today's webinar is specifically dedicated to chem therapies in management of menopause. In general, the belief is that menopause management is hormone therapy. But it is not true. It requires holistic approach, and only in 10% of the patients we need menopausal hormone therapy. Otherwise, in all patients we do not need hormone therapy. And alternative therapy has its role in selected cases. Across the world, in all the countries, people are using alternative therapies, and majority of menopausal women are using some form of alternative therapy for remedy of symptoms. We have observed that in COVID era, we observed, we understood, and we appreciated the importance of diet, exercise, yoga, and herbal ukalas or herbal therapies for build up of immunity to fight against corona, and it has been proved also. So friends, I am sure today's webinar will help to all of us in our clinical practice how to apply calm therapy in management of menopausal problems. My sincere best wishes to today's webinar, and now I am very eager to listen both the learned speakers what they will speak about the alternative therapy. I welcome. Thank you, Anita. Now, please moderate the session.
Okay. Thank you, Jignesh Bhai, for kind words for me. I'm always obedient to IMS and especially to you. You order and I will follow. So if you remain the president of IMS, I would like to remain the secretary forever.
I would like to become your secretary.
Okay. So now let us switch over to our own today's topic. For that, I would like to invite Dr. Nirmala Vaze. Dr. Vaze is a very polite personality. She is a very well-known personality. She is from Nagpur. She is National President of NARCHI 2018. She is Consultant Obstetric and Gynec Society at Sankalp Hospital, Nagpur. She is a counselor of breast and gynec cancer in menopause. She was past president and vice president of Indian Menopause Society 2015 to 17. She's the founder secretary of Indian Menopause Society Nagpur chapter. She was past chairperson of RCOG representative community West Zone India. This is counseling in obstetric and gynec breast as well as gynec cancer. She has conducted many trials for early detection of breast and gynec cancer. She was faculty for pelvic anatomy workshop at FIGO also. She's author of book of pelvic anatomy revised clinical application. This is editor of book of practicing approach to menopause management. She's a life member of, she got lifetime achievement award by IMA Nagpur also. She conducted project on anemia also in 3,000 school girls. So she is not only the menopausal practitioner, but she works in all the directions from adolescent to menopause. Madam is a very, very learned person, academically very sound, always smiling, very polite, very helping nature. And today we are lucky to learn from her so many things. Madam, now the stage is yours. I request you to start your session. Dr. Vaze, madam. Sana, please. Madam, please unmute. Hello.
Yes.
Yes, madam, unmute yourself.
Yeah.
Yeah. Now you are audible.
Okay. And can you see the slide also?
Right. Yes, madam.
So, okay. Good afternoon, everybody. And thank you, Dr. Jignesh, Dr. Anita, Dr. Rashmi, and Dr. Rama Vaidya, and of course, Sana as well, for giving me this opportunity today to talk on role of.
Madam, unmute yourself. Not audible. Hello. Sana.
Told me PMS meant punish my spouse. Here comes
Madam, please unmute.
Yeah.
Not audible.
Okay. Are you now?
Now audible.
Okay, so I thought that I would start with a lighter mood. That's why I put this video on. This was not made by me. This was made by somebody else. But this is what happens almost in every household whenever a lady goes through menopause, because the husband and the family members are really concerned about it. So we all know that the symptoms of menopause could be hot flushes, irritability, weight gain, osteoporosis, memory loss, vaginal dryness, insomnia, fatigue, and headache, and depression and anxiety. So when the patient walks in, she has loads of symptoms to tell you of, and here our job starts. We just cannot prescribe her the alternative medicine or whatever medicine we want to, but we have to take a detailed history of her age, her menstrual history, duration of her menopausal symptoms, as to when did she have her menopause, and is there any past medical history, and is there any family history of hormone dependent cancers. Then examination includes routine breast examination, abdominal and vaginal examination, and then routine investigations like USG, pap smear, CBC, blood sugar, lipid profile, thyroid, calcium, D3, B12, etc. So after doing all that, our role comes in here. And next go with me. So our management starts with counseling. Because I am a counselor, I always prefer to talk to them than awareness. I feel that awareness should be there even before they reach the menopause, and they should be made aware what are the symptoms, what are the vasomotor symptoms, and whether every lady will have it or not, and how to cope with them. Then lifestyle modification. Then menopausal hormone therapy definitely has a place, and alternative therapy is the last choice. So we start with menopause. The epidemiology is, as Dr. Jignesh said, that women living nearly 1/3 of their life after the menopause. So we feel that they deserve a good quality of life. In 2000, estimated 31 million women reached menopause, but in 2020, that is this year, about 46 million women would have reached menopause. So you all make sure that we treat this patient very nicely, politely, and it's a big challenge for all of us. So counseling, what is a counseling? This is an important part of menopausal treatment and will help in reducing anxiety, because the patients do not know what a menopause is, how to cope with that. When she has these symptoms, what does she do? Whether she goes to a doctor, or whether she talks to her family member, her husband, or their children. Then multidisciplinary and comprehensive approach should be there. I mean, women should not just passively accept that, okay, menopause, I am 45, 46, menopause has come and that is it. No. So they should be explained what may happen to them. So through counseling, few issues which cause more concern could be simplified, and we have to know how much they want to know. Not everybody would like to know in detail, because I do normally keep the models chart in my clinic and I explain them with the help of models. Next. So patient, when she comes in, or a menopausal patient, whenever you see, she has loads of symptoms, sudden emptiness in her mind, in her life, because the children have left for education or for job. And then she feels that nobody wants her. She is unacceptable in the family. She looks old and ugly because she puts on weight, and the family members avoid her. She has lost concentration and the confidence also. She keeps forgetting. Whenever she goes to a kitchen to open the fridge, she doesn't remember why she has gone to kitchen. And when she takes a phone call, she doesn't remember who the phone call was for, and she forgets to pass it on to her family members. And she always wonders how did her senior members in the family, they managed to and coped with all menopausal symptoms. Next. It is our job to tell her that she is not the only person in this world who is having this. There are many ladies, and almost all ladies will have the menopause, but not all of them will have the menopausal symptoms. So some ladies could have irregular bleeding, vaginal dryness, then hot flushes. Sometimes it is so bad that in winter also they want to switch on the fan, and the husband or the partner doesn't want it. Then mood swings. The husband or the family members say that she was never like this before. She has become very irritable, and for small little things she doesn't talk to us properly. She could be depressed. Then sleeping disturbances is one of the symptoms. Then she is worried in spite of going to gym and taking a regular diet, while she is still putting on weight. Low back pain, joint pain are the common problems, and memory lapse, as I already mentioned before. Next. So I always start with lifestyle modification. I think that is something that we all should concentrate, and be physically active. She doesn't have to run, but she can walk, or she can go to gym. Any exercise which will keep her fit and active, she can carry on. And yoga, definitely it improves the mind and body. And later on, I will tell you the advantages of yoga as well. Next. So it reduces stress. It is a deep relaxation at somatic level, and in different postures you can take. And it is a slow controlled breathing, that pranayama, anulom, vilom, many of you must have heard. And technique of calmness of mind by meditation or chanting of Om gives you a lot of relaxation to your body and your mind. Next. So there is a difference between yoga and exercise. In yoga, there's a slight tension on muscle, whereas in exercise, the muscle are stretched. Yoga, involvement of parasympathetic system, and in exercise, effect on sympathetic system. Yoga involves positive effect on endocrine glands, whereas exercise, no effect on endocrine secretion. There is no age bar for yoga, but exercise is not recommended after certain age. And yoga can be done anywhere, any season, and there is no need of any special equipment. Whereas in exercise, most of the gyms have very expensive equipments. Next. So what are the advantages of yoga? It's universally available. It's free of cost, anytime, any place, any person can do it. There's no side effects, no need of monitoring, and no fear of risk. See how this lady is doing Anulom Vilom. She's closing one nostril, opening other, and vice versa. Next. So there are few evidences which shows. The first one was involving 582 participants, and this meta-analysis, it suggests that yoga may be a useful therapy to manage bothersome vasomotor and psychological symptoms. The other study where there were more than 1,000 participants, it says that yoga seems to be effective and safe for reducing menopausal symptoms. So physical activity and health, yes, it reduces risk of many chronic diseases, promotes weight control, slows premature aging, and improves quality of life. We all know, we all keep on saying to our patient, even a pregnant patient, that about the diet. Yes, everybody has seen this pyramid, everybody knows about the pyramid. So the bottom part of the pyramid is we can have loads, like loads of portions of vegetable, whole grain, then plant oil, but eat less of red meat and butter. And of course, you have to drink loads of water as well, at least 5 to 8 glasses of water. So you have to eat less salt, less sugar, reduce caffeine and alcohol, and eat more fruits and vegetable. And those who are diabetic, they have to see that the sweet fruits they must avoid. Next. So Indian dietary herbs like turmeric, ginger, fenugreek, linseed, cumin, fennel, saffron, cinnamon. We all know that the exact pathway of action and side effects are very well documented. But the medical herbs like Ashoka, Yashti Madhu, Shankha Pushpi, and Shatavari, the exact pathway is and side effects are not clearly known to us. Next. So what can we do about hot flushes? This is a common symptom that the patient presents with. So during an attack, we must try and tell her to relax, cool down the body temperature with moist wipes, switch on the fan. And to reduce an attack, she has to avoid spicy food, coffee, tea, or any alcohol just before she goes to bed. Eat lentils, soya products, and always wear loose cotton clothes. Avoid hot water bath just before sleeping. But in spite of all that, if she still continues to have hot flushes, she has to see a doctor. Psychological symptoms, of course, positive attitude. That's what I have been telling my patients. Always keep a positive attitude, a healthy diet, never skip meals, exercise regularly, deep breathing, that is yoga, pray and meditation, and continue with your hobbies. Some ladies like knitting, sewing, gardening, reading, whichever they want and whichever they are more comfortable with, they can carry on doing the same hobbies. Is there any need to see a doctor? In asymptomatic patient, if she can avoid or if she can manage in-house, yes, that's fine. But in symptomatic patients, if she follows whatever I just said now, and if she still has the symptoms, she has to see the doctor. She has to remember, that is what I tell my patient, that autumn, after autumn, the fall comes. Actually, this fall, this picture is taken by me while I was in Canada. It is beautiful. It is really very encouraging and enthusiastic. And then the spring comes. So likewise, you know, menopause is not a disease, but it will come in her life and it will go away. But she has to know how she can manage with it. Next. There is a role of menopausal hormone therapy for women with premature or early menopause until she reaches the menopause, or for treating menopausal symptoms where risk benefit ratio is favorable, when of course there should not be any contraindication. And we must see that we should not start menopausal hormone therapy in women above 60 years of age. And there are contraindications as well: undiagnosed vaginal bleeding, thromboembolism, active or recent angina, suspected current past CA breast or CA endometrium, active liver disease, and uncontrolled hypertension. So what is the current status of menopausal hormone therapy? The current guideline recommends that lowest possible dose for shortest time possible should be given, and it is indicated in few cases or few problems. But only 15 to 38% menopausal women use menopausal hormone therapy, and 50% would discontinue use. Why? Because of fear of cancer, because of side effects such as bleeding, breast tenderness, bloating, headache. And they were told by their neighbors and friends and relatives that don't take hormone therapy, it will cause many problems. So that is why they stop on their own. Next. So here we come to CAM therapy. It's a group of diverse medical and healthcare systems, practices and products that are not presently considered to be part of conventional medicine. So what botanical supplements are there in CAM therapy? That is black cohosh, it relieves menopausal symptoms. Evening primrose oil, there is no effect on menopausal symptoms, but it can cause headache, stomach upset. Same with ginseng. Phytoestrogens we will come later on, and valerian also does improve menopausal symptoms. Non-botanical supplements, melatonin and vitamin E, some people advise, but it is not proved. But there are many mind-body therapies like acupuncture, Ayurveda, homeopathy, magnet therapy, paced breathing, relaxation therapy, reflexology, and Reiki. And the patients will ask you, doctor, which one do you recommend? It is totally up to us or up to her to decide. Yes. A trial was taken by an Ayurvedic doctor. She is my friend, and she treated about 20 patients, and she gave this combination of Jatamansi, Arjun, Yashtimadu, and Ashwagandha, and dose was 2 capsules BD. So each 500 milligram capsule containing 150 milligram of Jatamansi, 150 milligram of Arjuna, but 100 milligram of Ashwagandha and 100 milligram of Yashtimadu powder. And she said that after the second follow-up, after 2 months, there was almost, as you can see, there was more than 80% reduction in hot flushes, sleep problems, and there was 70% reduction in depression, irritability, and anxiety as well. Next one. So what is SERM and phytosERM? There are 2 types of estrogen receptors. We all know that, alpha and beta receptors. So what is an ideal SERM for these applications? It should not have no stimulatory action on the breast and uterus, and one that would block estrogenic action at this sites, yet would act as an estrogen agonist in bone, liver, and the cardiovascular and central nervous system. Tamoxifen and raloxifene are SERMs, and black cohosh extract is also a phytosERM. Soyam or isoflavone is a phytoestrogen used for peri and postmenopausal patients. One trial by Fori showed it reduces hot flushes, but the second trial by Panotti showed no difference. And the red clover, it's a member of legume family. It's also a phytoestrogen. Jerry and Van de Weer, they showed significant reduction in the number of severity of hot flushes. So black cohosh extract is also called Simicifuga racemosa. It is available in Eastern US and Canada, and it has multiple modes of action. It has estrogenic activity, and then it has SERM activity, where estrogen agonist at bone, at the level of bone, nervous system, and cardiovascular system, and estrogen antagonist also action at endometrium and breast. And non-estrogenic action is serotonergic and dopaminergic. So there are many studies done for black cohosh. Yilin said that he included 89 perimenopausal women and concluded that significant reduction in climacteric symptoms with remifemin. It is available in the market with the name of remifemin. And then Bai et al., he also suggested that similar to Tibolon, the effects are similar to Tibolon, but safety, there's less incidence of adverse effect. Then Osmers and then Nappy also said almost the same thing. Next. Next. But friends, there are certain contraindications for black cohosh extract like pregnancy, liver dysfunction, thromboembolism, undiagnosed vaginal bleeding, and hypersensitivity to black coach. Yes. So it definitely has an advantage over menopausal hormone therapy. There's no risk of hormonal cancer, no risk of hypertension, and advantage over tibolone is similar efficacy, but adverse effects are much less. Advantage over SSRI is similar efficacy, but no risk of adverse effects such as agitation, serotonin syndrome, etc. Next. And it is so surprising that in US 42% percent of ladies they use CAM therapy, and US has spent about $21.2 billion on that. In the same story with UK, they have spent about 450 million pounds, and 28.3% used CAM therapy. But globally, what does WHO say? WHO estimates that 30% of patients they seek CAM therapy. So there is an increasing interest in CAM. In 2000, a German study revealed 65% of healthcare workers, they use this. And as you can see in the next sentence, in the increasing order from 45 to 60% in America, France, Australia, and Canada, Canada has more number of 60% of the ladies in Canada, they use CAM therapy. And let us see what happens in India. The last sentence, 2,860 alternative medicine hospitals are there, 22,000 practice centers are there, and 87,000 practitioners are there. Next. So why do patients seek alternative medicine? Because they are not receiving enough care. Poor patient-doctor relationship. They don't know whom to approach, when to approach, how to approach. So they think that somebody told them to start, you start this herbal medicine, you start this medicine, and your symptoms will definitely improve. Loss of trust in modern medicine, then as a complement, as a trial, and they believe there is no or minimal side effect, it costs less. But I don't think it costs less. I think all these medicines definitely cost a lot, and it is less invasive. Yes. I always like this slide very much. I always tell my patient that menopause doesn't have to turn your life upside down. Next. And there will be many questions in patient's mind, you know that. So which alternative medicine you suggest and how long? Which alternative medicine should not be used? Which one should be used? Which lifestyle modification you suggest? Will the treatment cover cost, her treatment insurance plan? And she also wants to know whether she should see another specialist next. So finally, the take-home message is menopausal hormone therapy is still beneficial for some symptoms like vasomotor, fracture, urogenital, for the women who may be helped and appropriate for symptomatic women, but they have no contraindication. And there's a good evidence from last 50 years. So we have decided, the Indian Menopause Society and the International Menopause Society have decided to prescribe them the lowest available dose for the shortest period. WHI studies, I think Dr. Rama is going to talk a lot, and there was a lot of fear and confusion after this study, and people were really frightened, and that reduced the menopausal hormone therapy prescription after 2002. Next. So we all know that menopausal symptoms may worsen quality of life. And as I think somebody said, that fit at 40, strong at 60, and independent at 80 was the theme by one of our presidents in the past. So there is a trend shifting towards lifestyle modification, such as yoga, exercise, diet, and CAM therapies. Counseling and awareness, I always feel that it is very, very important through newspaper articles, models, brochures, and it definitely has a role to play. Black cohosh extract is clinically effective for relief of hot flushes. There are more RCTs are required to determine place of phytoestrogens in menopause management. More trials and studies are required to prove efficacy, effects, and side effects of these drugs. And menopause, we all know that it's a multidisciplinary team approach, and which is really essential. So not only gynecologists, but orthopedicians, psychiatrists, physicians, endocrinologists, nurses, paramedics, we all should come together and treat such patients. It's a clinician's duty to make the women understand and alert about the midlife problems. So menopause is an extremely stressful phase. we could all pause and spend some time with this vulnerable group. Lastly, what Swami Vivekananda said, that change is the law of life, challenge is the aim of life. You have to challenge the changes, not change the challenges. And I feel that we all should be able to dance like this lady. Thank you very much.
Thank you, madam, for a very lucid discussion regarding the calm therapy in menopause. So many questions are there, but I think we will discuss after the talk of Dr. Rama Vaidya madam. I request Dr. Rashmi Ben, my co-moderator, to introduce Dr. Rama madam.
Good afternoon, everyone. Can you hear me?
Yes, madam.
Yeah. It is an honor and privilege for me to introduce Dr. Rama Vaidya, our founder president, and one of the most respected person in IMS and a mentor to many whom she has guided and motivated to excel. She has been a friend, a philosopher, and a guide to me for the past 25 years. Dr. Rama Vaidya is a very renowned consulting reproductive endocrinologist, and she's currently honorary director at the Medical Research Center, Kasturba Health Society. She has been a deputy director at the National Institute for Research in Reproductive Health, ICMR, and has also been a member of the expert committee for reviewing projects, and has also taken up numerous projects with ICMR, Ministry of Health, Government of India, and with WHO. She is the founder editor of the Journal of Midlife Health, which is a very prestigious journal of the Indian Menopause Society. And she is also the chief editor of the Indian Practitioner. Dr. Rama Vaidya has been past president of the All India Association of Advanced Research in Obesity, and she has got numerous publications to her credit. And it is a pleasure for me to invite Dr. Rama Vaidya to give her talk. Dr. Rama Vaidya, please.
At the outset, of course, good afternoon, everybody. And at the outset, I would like to thank Dr. Dignesh Shah, Dr. Anita Shah, Dr. Jyotiben Shah, the treasurer of IMS, and Dr. Rashmi Shah. Also, my thanks go to Dr. Nirmala Vaze, because we have had many discussions when she and Dr. Gokhale, Ayurvedic physician, were making a formulation that was being targeted towards vasomotor symptoms and menopausal syndrome. Other Thanksgiving will be in the next few slides. Should I just do this? Now, at Kasturba Health Society, there are two medical wings. One is MJMS, a big hospital and a teaching hospital, which is a unique one for the internationally known, where it's a rural medical college and a teaching hospital. And the research wing is in Mumbai, and that is our Medical Research Center. Our Medical Research Center had been also awarded ICMR's Advanced Center for Reverse Pharmacology in Traditional Medicine and ICMR Product Development Center currently. Here you see that this group is a multi-system where conventional medicine experts, who may have super specialty expertise, also Ayurvedic MDs, Ayurvedic experts, homeopathic experts, and also it is a transdisciplinary team where you can see here that the first line shows in red color the people who are guiding us. Dr. Ashok Vaidya, who is a clinical pharmacologist and in internal medicine and has pioneered what is known as reverse pharmacology. Very important for me to have understood from conventional medicine and a super specialty in reproductive endocrinology, for me to understand what is the value of alternative medicine, alternative for us from conventional medicine, but it is a primary medicine or therapeutic modalities or management for other system of medicine. Other systems of medicine, India has pluralistic systems of medicine, and a large number of large number of people in India still use it as there is a primary line of treatment. The second green line that you see are all physicians, and the third line is the biomedical scientists with PhD. Some are medicinal chemists, cancer biologists, and others are experts in biotechnology. With this kind of a team, we had for decades together worked scientifically, asking questions, and I've stopped now saying that they are claiming. They means who? The other systems of medicine experts are claiming. I now don't say that they are claiming. I say that it is their observations. Their observations need to be put to scientific test, not only by them, not only by us, but together. And that's why we have had collaborations with various institutes, teaching institutions, those institutions which have modern medicine, conventional medicine teaching, also those which are Ayurvedic system of medicine, and also private hospitals like Balavati Nanavati Hospital, Tanvir Hospital, and Zankharia. Now, at these places, some of the IMS members we have collaborated with, for example, at Nanavati Hospital, we had with Dr. Priti Galvankar, who has remained a treasurer with IMS. At Tanvir Hospital, Dr. Meeta Singh, who collaborated with Dr. Ashwini Kumar Raut and us for DCSU. DCSU is a extract, standardized extract for bone health, and worked at a CSIR Institute, Central Drug Research Institute, and it was an excellent. When I was a member of their scientific advisory committee, I used to keep feeling that something which shows such good bone fracture healing, and also it prevents also the osteoporosis. Also, it has an influence on muscles, that means sarcopenia. I wish we would have had an opportunity to work on this. And few years after that, it did come that possibility. Dr. Meeta Singh at Tanvir Hospital and Dr. Raut and I and others, under the guidance of Dr. Ashok Vaidya, we had an opportunity to work on this, and it was published in none other than the JMH, our own journal, where it got the best award for the year prize. I'm very happy that it's only by this kind of collaborations that we could find out that what we used to say that it is their claim, maybe we put them by observational studies, and sometimes even in the evidence-based pyramid at a higher level of RCTs and double-blind also. At the R.N. Cooper Hospital, Nauroji Wadia Hospital, Dr. Geeta Balsekar, Dr. Shirodkar, and Dr. Chavan are going to be our collaborators for further work on this issue. And I already mentioned about this issue where Dr. Meeta Singh and Dr. Raut and us, we worked. And it has to be taken forward now because it has shown that it is an anti-osteoclastic. It decreases the alkaline phosphatase. It decreases the TNF-alpha, that is anti-inflammatory. and it also decreases CRP, HSV CRP, high specific CRP, which also shows that it is anti-inflammatory. And this is a standardized drug, and I'll talk about phytopharmaceutical. So this drug would get also developed as a phytopharmaceutical, and a phytopharmaceutical is also under regulatory, that is under the CGI. So this drug is under development. Other thing that I would like to talk about is that many of our colleges are having co-locations. Ayurvedic medical school as well as conventional medical school, they are co-located. If they are co-located, can't we talk to each other? What happened was, once Dr. Supriya Bhalera, a highly acclaimed Ayurvedic physician who has also worked in integrative medicine, and she was working with none other than Dr. Urmila Thate, Dr. Sharadini Dahankar, and Dr. Renuka Munshi. When she shifted to Pune, she came to us, to Dr. Vaidya and us, and she asked, what should I work on? And we thought that she could work on antenatal care. How is antenatal care provided in Ayurveda? And we thought that unless we know that, and Dr. Jyotiben Shah very nicely, when we were doing a survey of modern medical gynecologists and obstetricians, that do you come across patients who are taking Ayurvedic medicines in their antenatal period? And she says, yes, Garbhapal Ras is very widely used. And so we looked into this, said, what is Garbhapal Ras? And I will not have time to go in detail because we are not talking about antenatal care today, but we organized an integrative dialogue at D.Y. Patil Hospital where Dr. Badwar, I'm sure she's in audience, and it was an excellent eye-opening for us that she and Dr. Divya, head of the department of the OBGYN from Ayurvedic side, this is co-located, and Dr. Dave, who is a medical director at MRC, myself and other colleagues of mine, we all went to, and Nandita, then the folksy president at that time, came and inaugurated this dialogue. I think there is a need for a dialogue. Dialogue does not mean you adopt whatever they are doing. I think we need to observe and bring scientific tools for that observation to see the efficacy, to activity, safety, etc., and involve them with they have experience. There are many good articles that says harnessing clinical experience, harness the clinical experience which is in abundance in our country. So this came to us, Dr. Vaidya and me, as a kind of a, and Dr. Rashmi Shah asked me, what is your message today? I think my message when we are going to talk about the integrative therapies in context with MHT, more menopausal hormonal therapy, would be nothing else that if there is a possibility, and Dr. Jignesh Shah, as I talked to Dr. Nandita, and I talked to Dr. Nandita just 3 days back for asking her that I'm going to project your image here as somebody who's willing to see that there is a need to collaborate. And I asked Dr. Jignesh Shah also, why don't we invite the OBGYN specialists of the other system of medicine to at least talk to us, and we talk to them, because otherwise we will keep on borrowing integrative therapies from modern literature and conventional literature where they would not have had any opportunity to see firsthand all these things. So there is a conventional medicine, there is Ayurveda, they are physically co-located together, and they may have a life science labs. Life science labs are there, statistics is there. All this can have a possibility of inquiring scientifically into the basis for which today, for example, Dr. Nirmala Vazir did make a mention. She made mention that sometimes patients want. Patients come and say that I'm taking this and they want it. At that time, we always, and I used to say frankly, oh, it's not my area of expertise, so I don't know, you take it at your own expense. I think we have to stop doing that. And that's why, what is evidence-based medicine? Evidence-based medicine has 3 components. A component is that the physician gets aware of what is the state of art today and what is the emerging scientifically emerging components of that particular area, then it is you are informed, and that informed choice by giving ideas and awareness and sharing what is emerging with the patient. The patient makes informed choice and your own experience. So physician's experience is equally important, and that's the evidence-based medicine. And that's why in integrative, if we want to become evidence-based, then we'll have to work together. And that's why the voyage of discovery is not in seeking new landscapes, but in having new eyes. And that's why pharmacology from modern medicine, Dravigun Vigyan from Ayurveda, this, when the experts from these areas and these disciplines talk to each other, many things we will learn, which would be now some of the experience that we have had. I would like to share those with you. So East is East and West is West. A school of thought could be menopausal symptoms is only Western phenomenon. That was some times ago, some decades ago. Claim for women from East is that they are protected because of the dietary, social, and cultural factors. But the multi-ethnic communities living in Western countries as well as in Asian communities have found that menopause and its consequences are similar worldwide. And in few slides, we'll see how high is the incidence of menopause-related, menopausal syndrome-related symptoms in our own country, which are very nicely published in JMH. And so my first question would be, if menopause and occurrence of its consequences are similar worldwide, are therapeutic modalities, guidelines, and management strategies similar? The pluralistic healthcare of India offers a vast potential for the exploration of additional modalities for the management of menopause and its associated symptoms and complications. It does. And so let us look at it. This was also an opportunity that when WHO trial outcome came in 2002, we were in Delhi, Urvashi Jha, and we all were making the guidelines, national level guidelines on the basis of HRT, WHO trial, other guidance. But that very time, a message came that please stop, suddenly stop. And you all know what happened. What happened was that Women's Health Initiative results announced and went down. Not only that, the prescriptions have gone down, but it has created left such a, what should I say, in the minds of community and people that they fear. It has also caused a little bit of a diffidence, though, as we wrote, Dr. Shefali Pandey and I, we wrote that ERT, HRT, post-WHI study outcome dilemma was there. There was a debate and there was an emerging consensus. And that consensus then finally said what Dr. Nirmala Abase twice repeated, that give MHT in smallest dose to only symptomatic, shortest period, and rule out the contraindications. So MHT was born. It was a therapeutic gap. But simultaneously what happened was, and I don't have that figure here, but simultaneously all over the world, interest in the CAM as well as alternative medicine grew leaps and bounds. Yeah, I would like to not talk too much about it, but I would point out that those who are IMS members who are very active in making guidelines, please read this article. It has come to my knowledge only because of this invitation, and I went through that what has happened to MHT now. HRT went through a premature termination at 5.2 years. Now this MHT, that is menopause hormone therapy, redefined, crystallized in its guidelines, is also almost 7 years. So what has happened? And somebody has done a meta-analysis of the worldwide epidemiological evidence for breast cancer. And this is a collaborative group on hormonal factors in breast cancer. And it is in Lancet in 2019. I don't think time permits me to go into the detail, but sufficient enough for me that there are two aspects that we need to look at, and that is breast cancer with MHT as well as thromboembolism. Coming to the nationwide prevalence of menopausal syndrome, rural community also has a high incidence. Also, what is emerging in a very good article in JMH, which talks about diversity of menopausal experience across India. What emerges most is fatigue. Fatigue, Shefali Pandey worked on it when we were having ICMR's phytoestrogen project. At that time, we were working on a Maitri model of menopausal healthcare. 294 women were looked into, divided into premenopause, perimenopause, and postmenopause. Fatigue was highest in perimenopause and postmenopausal women. And a woman who said that, oh, I do like this. My husband comes home and tells me that there are 35 people today for dinner, and there was no problem. But suddenly, I have no coping. I can't. I get fatigued. I get tired. And what we did was, and before I say that, I have put, I don't know why this slide. I think I'll come back to this slide. Let me go to the next slide. We looked at Glycyrrhiza glabra. Glycyrrhiza glabra is nothing else but Gestimadu. And this was one of the plants. We worked on single medicinal plants because ICMR demands that we don't work on formulations, but we work on single medicinal plants. And this project was given to us much before WHI came because we were interested in menopause as an area. And we wanted to work on medicinal plants where there were observations that it helps. So Glycyrrhiza glabra, menopausal transition, which encompasses in reality bio-psycho-social life transition, besides studying the pharmacokinetics, cardiometabolic effect, and safety profiles, quality of life was very important. That's what we studied. And this Glycyrrhiza glabra was adjusted. It was a standardized formulation that we got from Zandu, where they standardized against a bioactive phytomolecule that was glycyrrhizine. And you will see in the next slide that it is the glabridine which is more important than glycyrrhizine for the estrogenic activity and for the fatigue. Here you can see the structure of glabridine, and above you see the structure of estradiol. Very similar. Phenanthrene ring and also the aromatic, and you can see where the hydroxyl molecule is there. And this is glabridine is at a para position, while this is at the 3 position. And Shefali studied this in quite detail of the fatigue. That the fatigue was more anxiety, work stress, and psychosexual. All these were also at this submerged and also expressed as fatigue. So we looked into glabridine, we didn't do ourselves, but the literature showed us that glabridine has significantly inhibits fatigue. It extended the exhaustive exercise time of mice, effectively delayed the increasing of blood lactic acid, and increasing the storage of liver and muscle glycogen. This was sufficient enough. Women came back and said that their energy level have suddenly started coming up. Their lethargy, their fatigue has disappeared. Of course, their hot flushes had also disappeared. And the quality of life score, I don't exactly remember what it was a score, but it was a 36, and we had modified for our need. And it was a validated score, and where we found that there was a tremendous decline in the score with the vasomotor symptoms disappearing, hot flushes, insomnia, fatigue, etc. And also we found that there was a change in the lipid hydroxyperoxides, and baseline was 6.11 plus minus 3.7, that dropped to 3.91 to 3.84. So there was a significant decline in the, which is also known as that oxidant damage is lessened. Similarly, worldwide experience had shown that hot flushes and night sweats and the insomnia improves. Hot flushes and night sweats, and various articles from the literature here shows that it declines under various phytoestrogens. We also had an opportunity, and we had Dr. Chandrasekharan, a medicinal chemist. We outsourced, and Dr. Chandrasekharan from our own MRC, we worked with Dr. Manon, and we did, because at HPLC, we are equipped with HPLC, so we could identify the Cmax as well as Tmax, but we needed to confirm it with LCMS. And I went to Dr. Ganguly, then the DG ICMR, that said, we need LCMS. So he said, do you know how much it costs? Now, why am I mentioning? It's not that he denied it to us, but he said, just outsource, I'll fund that. But do not ask for such expensive instruments at your place. So with limited resources, we'll have to work. If we don't collaborate, we cannot get the answer. We may have hypotheses. Observational studies in the area of epidemiology, observational studies will create hypotheses. But in order to confirm that, you will require that the suitable biological markers are identified, as well as what is needed to be done once the hypothesis is created. It is put to test by clinical trials, RCTs, double-blind trials, etc. Now, plasma levels of genistein in 6 healthy volunteers was done, and it was shown that the mean peak level comes at of 315. It comes around at about between 4 to 5 hours, and also it was observed after ingestion of a soy extract equivalent to 31.76 milligram of genistein. It showed that it gets observed. Also, we did it in 19 volunteers who were on soya extra, where genistein and diazine, it was a standardized product. We found that there were variable levels also. It did show us the compliance, but it also shows that the GI tract interferes with absorption. There could be a variability. Very important. Now, if you find that a bioactive phytomolecule in a plant product is a particular one, genistein is isoflavone. Now, genistein, when was converted as the NCE, new chemical entity, they wanted to make a brand name because they wanted a food component development for bone health, and so it became a new chemical entity. It becomes a new drug. Then it has to go through another regulatory mechanisms. It prompts me to share with you that now in India, the regulatory DCGI, Drug Control of India, you have to go to them if you are developing like DCSU, which is a phytopharmaceutical, because phytopharmaceutical demands that you have to have one bioactive molecule standardized in that product, as well as other 3 phytomolecules identified, standardized against that. So that is under DCGI. New chemical entity like genistein, if one was to develop, that requires also. So the alternative that we are talking about will fall into several categories. It can be Ayush drug, which will follow Ayurvedic pharmacopoeia and has another regulatory. If you have genistein like single biomolecule, like estrogen, you want to use it, then that has, like they had to do preclinical animal studies, they had to do genotoxicity, acute, subacute, chronic toxicity, reproductive toxicity, clinical volunteer studies, pharmacokinetic studies, phase 1, 2, and 3. And so it goes through entirely a different regulatory mechanisms. As against that, what I feel, we as IMS members, as menopausal health care providers, we could find out from our Ayurvedic friends. We studied together. One went into Ayurveda, another went to conventional medicine. Why can't we talk to them? What are your experiences? Can we also monitor by our biomarkers that we want to? At that time, you are not under any medical legal because you are only observing. If you are going to make it as a project, you will have to go through the ethics committee. You will have to provide informed consents. That is entirely a different story. So phytopharmaceuticals is now a gazetted entity and it is under DCGI regulation. Now talking to our own Ayurvedic colleagues, Rajo Nivrutti is a concept in Ayurveda, and it also has to have, they say, that there should be the reversal of the pathology, and that guides them how to treat Rajo Nivrutti. Rajo Nivrutti timing has been identified in both Sushruta and Bhagavad. It is 50 years of age. When that recognition is there, and also what I have put here in red is they feel that Nidan Parivarjan comes by Ahar Rasayan, Achar Rasayan, that is lifestyle, change in food habits, and Aushadhi. And identified Aushadhis, some of them which we took it for the phytoestrogen project of ICMR, and I showed you that it was Vidania somnifera and Glycyrrhiza glabra. Similarly, we talked to Dr. Survi, who is our homeopath, and what surprised me in her telling me about what are the medicines they use was, of course, they say that we don't use single medicine. We always go through the constitution, and accordingly, besides this, there may be a specific medicine. And Ectia racemosa, this is nothing else but black cohosh. So I had a chat with those who are having in the market black cohosh. To them I asked that, do you provide it? Who is your prescribers? Are homeopaths taking it? He didn't have that answer, but I would have liked to find out that black cohosh, which is available in market, which Dr. Nirmala was made a mention about it. She had about 4 or 5 slides on that black cohosh. Who is using it? There is a need to do pharmacoepidemiology of traditional medicines. And if we have to familiarize ourselves, and if we have to also adapt to alternative medicine practicing and our prescription writing that Dr. Meeta Singh very nicely has done for MHT and others, we could start combining our efforts with them in collaboration and refine and fine-tune these prescriptions. So what are available formulations in market could be many. I have picked up only 3. And Remifemin, which is mentioned by Dr. Vaze. Then Ivoneva is a Charak product, and it has Jatamansi, Shankhapushpi, and Brahmi. While Menozan is a Himalay product, and it has Saraka, Ashoka. We had worked on a product of Tooth Papeshwar, Ashotone, for the menorrhagia, which could be puberty menorrhagia, or at the end of her reproductive life, that is perimenopausal menorrhagia. We had worked with Dr. Priti Galmankar, Dr. Shankari was alive at that time with them, and we found that it was effective in the ovulatory bleeding, but not in anovulatory bleeding. So subset identification may emerge. If we would to collaborate, subset identification can emerge. And then afterwards, I still remember that few of the gynecologists who collaborated with us have started prescribing that because it was very effective not only for menorrhagia, but associated premenstrual tension syndrome. Now, this is from Dr. Sonia Malik's. She has done an RCT where she has compared for the hot flush score estradiol valerate. The response is 91.9%, conjugated equine estrogen 89%, isoflavone 60, and placebo 47. Why have I picked up this of Sonia's work? One thing, it is RCT. Second thing, so that there is objectivity is brought. Second is that if you find that a particular compound, a particular drug or therapeutic modality that you are using has efficacy, but at the cost of high risk. While if you have another modality which is giving you little less, but it is active. Look at this. It is active more than placebo. Isoflavones, which are, we have seen Genstein, we have seen that also in other glabridine, etc. And they are coming as a formulation with a plant one particular part of the plant or two parts of the plant as an extract, it will have some other components also. So we do not know, but we need to find out what is benefit risk and what is cost benefit. Cost benefit and benefit risk must be learned. And when it comes to individual patient, if she's suffering and she's really suffering so badly that she just can't sleep and you want to give for a short period of time, certainly I think that estradiol valerate would be more effective than the others. But if it is not so, and if it's mild, so we will have more opportunities for therapeutic choices that we can take from other system of medicine if we were to work with them. Now, Dr. Vaze had asked me that for exercise and for yoga, we do say that because today we were to compare for vasomotor symptoms, menopausal syndrome, MHT, and alternative. We were not talking about lifestyle. Dean Ornish proved reversing heart disease long ago by lifestyle. And nobody can deny that today's lifestyle, which has 5 very important components, can reverse heart diseases, can be a primary prevention, can be a secondary prevention, can be therapeutic. But here the specific question was of the menopausal syndrome and not how important it would be. And so she did talk about a systematic and meta-analysis where for yoga she did talk about. However, for exercise, I'm not too sure. Why I'm not too sure? Because some exercises are aggravating hot flushes, while other exercising are not as useful. It may be useful for your cardiac health, but it may not be so useful. Now, what is actually, we didn't have time to go into the pathophysiological mechanisms of hot flushes, which is nothing else but an imbalance between sympathetic and parasympathetic autonomic system, heart rate variability. All these things are available to us. So, and they are simple. And if they can be done, then we could put to test even the medications that we are going to likely to use. So here, one exercise group had received menopause specific information DVD, and the other one was only a support group and exercise. And they found that exercise is not effective treatment for hot flushes. And there have been many studies which is showing that. Exercises are many types, and that's why what one would want to take can be taken with a physiotherapist. Or now there are so many physical therapy related organizations which are specializing in that. We could take up this as a question. Okay, now I just wanted to share something that I came across, and I asked, whom did I ask? Maybe Jignesh Bhai or Anita or anybody else, but remember.
To me.
You
asked me, madam.
You
had a talk with me, madam.
Yes, thank you so much, Anita.
Yes.
And the society from, I think it is which society, which has specified suspected COVID-19 woman, if she has MHT, what will you do? And this is a 2020 April publication where the society has identified and provided an algorithm. I am not able to see myself here, but I have written out the reference, and the reference is to, it is Spanish Menopause Society, and it has appeared in Maturitas, April issue of, and it says that they confirmed COVID-19 women with using MHT. She has more chances of thromboembolism because even COVID-19 have the same kind of a problem, and you are exaggerating this problem. So they've given a very nice algorithm, and there are 2 such beautiful, which I don't think I've gone into the great detail, but I would like to suggest that that should be done. And so my last slide is that the group genius is what? Group genius is a close collaboration between, and we are a pluralistic system of medicine, and we should really, research prospers by collaboration. And with these words, thank you so much that you've given me this opportunity, not only to speak to you, but to speak to myself. Because even while Dr. Vaidya is having right now a problem, he continues to guide us. He continues to guide us. I'm very thankful to two of the members of the Scientific Advisory Committee, Dr. V. Prakash, who continues to take interest and every 6 months personally visits us and guides us. Dr. V. Prakash is nobody other than internationally known nutritionist and a food technology expert, was a director of CFTRI, CSIRI's Premium Institute in Food Technology, and also Dr. Garg, who is from Sister Institute Community Medicine Professor and Secretary to Kasturba Health Society. I'm very thankful to Dhirubai, Dr. Garg, Dr. V. Prakash, my colleagues, and to Dr. Ashok Vaidya. And I can't miss out on Professor Vidita Vaidya, who is a neuroscientist, a very senior neuroscientist in TIFR, who has completely helped me today for today's presentation. Thank you so much.
Thank you very much, Dr. Rama Vaidya. Your talk has always been very motivating, very informative, and very thought-provocative. All our audiences could benefit from your studies, the Indian studies, which are very much needed for all of us to undertake, and always not copy Western studies. That was a very good message. You also told us the importance of collaborating with institutes to have dialogues with other specialties, which is very, very much lacking. And I hope the Indian Menopause Society and other members take this advice very seriously and see that we do come up with nice collaborative Indian data. Your personal experience on all the different soy products, other products, and the integrative medicine approach is really very enlightening. Thank you very much, Dr. Vaidya. And I would request Dr. Anita to take up the session further, please.
Yeah. Thank you, Rashmi Ben, for a nice comment. And thank you, Madam Rama Vaidya. You are always at your best, and always Rashmi Ben told that we are always getting a lot much inspiration from you.
Thank you. Thank you.
So now just we would have so many questions. I will try to just put it, and how many of them we can solve. We will try to solve as many as possible. One question is there, madam, when to start alternative regime, before MHT or in association with MHT?
To whom this question is, Dr. Vaze?
Yeah, Madam Vaze.
Unmute, please, Dr. Vaze.
Can you hear me now?
Yeah. Yes.
I don't think we should combine two therapies together. If we are prescribing her MHT and knowing that she has no contraindications and she is willing to take it, then MHT only should be enough. It shouldn't be combined with alternative therapy, no. And of course, as I always stress, that counseling and awareness, counsel her, explain her that she has to take this medicine, she needs this medicine for whatever reason or whatever indications she has, for a shorter time and for a smaller dose.
Could I answer this also?
Yeah.
Yes, madam, sure.
You have to remember drug interaction. Now, when we were having a project on the anti-diabetic, exploring Anicostoma litorale from the alternative medicine, and patients who were already on metformin but uncontrolled. So uncontrolled metformin patients were also put on this, and they started deteriorating. I went immediately to our research director, Dr. Ashok Vaidya, and I said, no, I don't want to work, because at that time I was new to this. And what answer he gave was so, I still remember. He said that there could be a drug interaction because you are simultaneously giving. If you want to give, and then we did a topic, we did drug interaction, and we found that the synergistic action will be useful to the patient provided you give it at different time and how much you will give the dosage. So it's a subject drug interaction, how to study and how much to give both together, because the targets can be different. See, today we understand that diabetes or other syndromes that we talk about, it has many targets and many symptoms. So certain target is a particular symptom. For example, we found that Anicostoma litorale definitely decreases glycation, may not decrease blood sugar, but glycation goes down. So it might be useful to combine, provided you have done research, understood it, and then utilize it. Otherwise, I agree with Dr. Vaze that don't give it. Use what you think that you have experience with and where there is a established guidelines of others' experience.
Thank you, madam, for a very nice clarification and advice. One question is there, what health tips to follow post-menopause? As such, both madams have given very nice tips for all the postmenopausal symptoms and how to solve it. But in short, again, Dr. Vaze ma'am, please.
I always feel that you should keep the charts and models in your clinic, because it takes so much of your time to explain them. So it's always you tell them that, okay, these are the exercises. And what I say is, you don't have to do all the exercises. You don't have to do all the steps of Surya Namaskar. Whichever you can do, whichever you are happy with your, or if she has any medical problems, then she has to tailor the exercises depending on her morbidities and comorbidities. But yes, I do believe in exercise and yoga a lot.
Thank you, madam. One question is, at what age does nutritional supplementation help post-menopause? We have already discussed, but madam.
We've already discussed that. I always tell them that when you're approaching menopause, you must arrange your wardrobe, you must arrange your kitchen, and make sure that whatever you're eating is the right amount of food that you're eating. As I showed in the pyramid, eat less of the top with the lean meat and all, and have more portions of vegetables, more water to drink, and more exercise and yoga. Yes, so she has to change her wardrobe and she has to change her kitchen and her dietary habits as well.
Yeah, so she always needs some supplement. If it is not properly, she is not doing. One more question. Which therapy do you think is the most appropriate to apply to the postmenopausal women, and why?
Dr. Rama wants to...
Rama, madam.
Which you know the best, and where there is crystallized and proper guidelines are already written up, and you have... See, if I'm from conventional medicine, as a research scientist, I may do something else. But as a practicing physician sitting in my clinic advising my patient, I would follow it from where I'm trained, where I'm comfortable with the guidelines, because I may be a part of the guidelines preparation for that medicine. But when I've said that when we are today talking about alternatives, we have plenty of opportunity to explore. See, IMS as an organization has multiple responsibilities. One is to draw guidelines, which is for the conventional medicine, because mainly it is a multidisciplinary with a not other system of medicine. It is with the modern medicine or a conventional medicine. So it can only be a multidisciplinary within that conventional medicine, orthopedic surgeons, endocrinologists, etc. But when you are talking about, suppose you are adopting the other one, then either, and that is the reason why I was requesting Dr. Jignesh Shah, who has a great opportunity today, and to Anita, that both of them can also extend help and create associate members from pluralistic system of medicine. So that we would have dialogue sometimes with them and they actually present their cases. And if such cases are available to us from that only, how did Dean Ornish came up with the lifestyle where there is a reversing of heart disease, and that became now acceptable to everybody. So it's a question of doing it in a proper scientific way. And as I said, benefit risk ratios, cost benefit, everything. What has happened is that medicine is also, unfortunately, has a commercial viewpoint. It has also, so if you are looking into pure universities, pure medical schools, you have opportunity some things which may refine your guidelines. Okay?
Yes, madam. Thank you very much. We know that IMS is taking very much pain for preparing the guidelines. And now recently only Dr. Meeta is just putting it with all the supports of the members to put the newer guidelines. And I think that will be ready within few days or few months perhaps.
Yeah, it's a lot of work, and congratulations to her and those who are helping her.
Yes, madam.
And we are highly appreciative of their efforts.
Yes, madam. One question by Dr. Shushma Bakshi. Should we make it as a routine to start alternative medicines in perimenopausal phase and onwards?
See, routine, as I'm telling you, yeah, you have a very close friend who is an Ayurvedic physician, and you can vouch on her experience that this is safe. This will give to your patient, and it would not. Don't forget medico-legal. Cross-pathy today, prescriptions are legally not okay. So if you are going to prescribe, you will have to bring it to a level which becomes acceptable by your body, like IMS body, which can go to the DCGI. I mean, these are something you cannot start taking, but your eyes, today my talk was to open our eyes. And if we open our eyes, we'll be able to incorporate something which emerges somewhere else in the world, and we will be the last one to adopt when it will be at home only available.
Yes,
but it's a process. So it's a process. It's not an end.
Right, madam. Actually, we Indians have a very rich treasure of all these knowledge of Sanskrit and Ayurveda and everything. But usually, એવું કહેવાય ને કે બધાને બીજાનું જ સારું લાગે. Then we always follow the Western culture and Western people, and they are following our culture, and we are not giving proper importance to that, our own thing, madam. One question is, madam, is the soya isoflavone in thyroid menopausal women is recommended?
What? In
soya preparation in thyroid. Patient is having hypothyroidism and she is menopausal. Soya should be preferred or not?
I don't think that should be any problem. I don't think so.
I don't think so.
Yeah, because these soya preparations which was available to us for work and it was in market,
yes,
was specifically a standardized product.
Right.
When we know how much we are giving as an estrogen, it's like this, that if you were to give estrogen equivalent, then would it be that you cannot give to the hypothyroid? Always hypothyroid patients, at least yearly, once she is stabilized on a particular dose, we are always following them, no?
Right. Yes, madam.
Yeah, a long discussion today I had with Dr. Meeta Singh, because she's preparing guidelines and it is still not. We were having certain discussion. At that time, she said that menopause health care has become a super specialty. And since IMS does have also training programs, as well as you can become that menopausal specialist, you would have learned about the emerging knowledge about the menopause and its healthcare and its guidelines. So with that, she says that anybody who runs a specialty clinic of menopausal clinic is bound to give a follow-up and not give just a treatment as a prescription from a family physician. Of course, family physicians also follow up, but the follow-up is a must.
Right. Vaze madam, best for dyspareunia, is there any local application thing from calm therapy? Any preparation available? Hello.
No, I don't think so. I have not read it. But
Right.
yes, there are estrogen creams. And what it is said that when we are giving estrogen by mouth, orally or transdermally, they are absorbed and they go into the system. But whereas if you give them vaginal application, even the estrogen, even in hormone dependent patients who had hormone dependent cancers previously, the absorption of estrogen is limited to only vagina and of course urinary problem. So it is
Madam,
said that what I read is quite safe to give them estrogen cream vaginally.
isoflavone creams are available with good results also.
Gel,
Two companies are
isoflavone gel was
marketing.
available.
But I have not
Replicas
tried.
and Juventus both are marketing it.
Okay. I have not tried, but I do
Right.
explain to the patients that, whenever I put them on HRT or sorry, MHT, I do keep a follow-up, strict follow-up for at least 1 year, and I see them every 3 months.
Madam, what is the role of flaxseeds in postmenopausal symptoms?
Flaxseed तो ऐसे भी use करना चाहिए regularly. We all are like
right.
So for a long time I did know what a flaxseed is, but you can make different preparation. In fact, you can have a dry chutney, which is very tasty. And you can use it as a mouth freshener also.
Yeah,
But
you can
yes,
spread it over salads also, and even
yes,
in buttermilk and anything you can. Anyway, you can use it.
yeah.
Yeah. So other few questions are there, but not related to today's topic. So I think we can end over here. Rashmi, do you want to?
Can I
share
ask
something?
one question, Anita?
Yes, sure.
There is a belief that by using this phytoestrogen, we can reduce the dose of estrogen if we use it simultaneously. So many of the practitioners are using both the things together, phytosums along with low, very, very low dose estrogen. Is it to be allowed or not? Because there are no studies, no guidelines, nothing has been said in the literature. And many gynecologists are doing this thing. One prescription of phytoestrogen and along with some low dose estrogen therapy. Is it to be allowed or not?
I think it should not be.
No, Jignesh, even I agree with Anita, it should not be, because if she has already been prescribed MHT, MHT should take care of her symptoms, isn't it? So why does she need phytoestrogen over and above that?
Right.
So no.
To reduce the dose of estrogen, because the phytoestrogen will work, will be having its estrogenic effect along with very, very low dose of estrogen, so that the estrogen dose can be reduced or minimized.
I will not agree. No,
So
sorry.
that is a theoretical thing that has been taken.
Yes.
Madam Ramaben?
No, I don't know, because whether they will compete for the estrogen receptors, and even the smallest dose could compete, and I have no idea. I mean, and that way, if you go to see, there are many of our food substances which would have, for example, soya is also a food product, no?
Yes.
In that way. So, but only thing that it is never taken as a dose on a regular basis. A food would vary. You may occasionally only take. So that's entirely different than when you take it as a combined therapy. So I don't know. I mean, I won't have an answer to that. I would have loved to work. Suppose somebody is doing that, and just look into what's happening. So just giving and prescribing it, but definitely find out what's happening.
So most of the
last
time.
Question. One last question.
Okay. No.
Can we prescribe Ayurvedic or homeopathic medicine being an allopathic practitioner?
Yes.
Can we?
I think
we are allopathic practitioner. Can we prescribe Ayurvedic or homeopathic preparation?
If you ask me, legally we are not allowed.
Yeah, legally
so
no.
when we applied for these projects from the government regulatory agencies or the councils. Government councils insist that you must have Ayurvedic physicians with you. And
Okay.
fortunately, at our place, it's not only an Ayurvedic physician, but they are experts. And so we
Okay.
work together. So while a research is entirely different than going into the practice, in my Vasudha clinic, I don't practice Ayurveda at all. I don't practice only because I'm not legally allowed. And so
Okay.
therefore, legally, we are not allowed. However, as an organization, Indian Menopause Society can take up stand, work with the legal permissions, and follow the proper processes of research. For any drug development, whether you are developing a drug for a phytopharmaceutical, nutraceutical is under another regulatory agency.
Right.
So the regulatory agency, then ethics committee permission, so it goes to proper protocols.
Yes. Then we can.
Once proper protocols, then IMS can say that yes, it has gone through this research.
Okay.
Because this is the outcome, and on the basis of that outcome, we are allowed.
Okay.
You're absolutely right, Dr. Vaidya. Even if the patient insists that she doesn't want any allopathic medicine, then I refer them to my Ayurvedic friends, and I said they are in a position to write a prescription, whereas I am not. And
That's
they can
why I don't know how many of you read the Indian Express article. In that, it was very nicely mentioned that Dr. Ashok Vaidya, who has pioneered after his clinical pharmacology work, reverse pharmacology, where it is a discipline by itself. It has definitely, and so whenever we have any project on reverse pharmacology, we go through a very strict ethics committee permissions, and whichever agency is funding, that funding can come from DBT, DST, ICMR or Ayush. It has to follow certain guidelines of making drug under that category.
Okay.
That's why I did define that a phytopharmaceutical comes under DCGI, as the new chemical entity also comes through that. The same way, something may be FSSI or something may be Ayush. So it has its own, and that's why prescription is out of question today.
Okay.
From us, from conventional medicine people.
Okay. Okay. So thank you very much, Madam Rama Vaidya and Dr. Nirmala Vaze, Madam. It was a really very nice discussion. Thank you very much, Dr. Rashmi Ben also. Madam Rama Vaidya, all the IMSians will be having very happy to listen to you after a very, very long time. By seeing your face only, most of, rather everyone must have taken much inspiration from you, madam. So again and again, thank you very much. Thank you, Rashmi Ben, for participating and helping in this webinar. And we are very much thankful to Sana as well as Bharat Serum for organizing this webinar. All of must have enjoyed it. Thank you very much, madam.
Thank you all.
Thank you.
Thank you, everyone. Thank you.
Okay, thank you, madam.
Just a small vote of thanks I would like to say. Please allow me.
Yeah, Sana, please.
Sana, yeah. Yes, Sana. Okay, should we exit?
Thank you very much.
Okay, bye, Sana. Thank you very much.